Well, welcome everyone. I'm excited today to have a conversation with Alexander Drain, which I'll introduce in just a moment. We're going to be talking about a topic that's a big concern of huge proportions to our industry. And there was a report that just came out, a survey from the CDC just last week about this. And so we felt it was very important for us to have a conversation about it. And we're adding it to our agenda for the Healthcare Marketing Physician Strategy Summit this year. So with that, without further ado, I want to jump in and introduce Alexander Drain, who is co-founder and CEO of Rebel Health and Archangels. She serves as a wellness expert for a lot of big companies, including Prudential, and she co-founded Eliza Corporation, Engage with Grace, and three other bootstrapped companies. You could tell she's a serial entrepreneur. She is also a cashier on leave for Walmart. An interesting fact about you, Alexandra. I appreciate that. But you really believe in retail as being the front line of health, and that caregivers are our country's greatest asset, and that we need to expand sort of the definition of health to include all of those aspects that are not within the healthcare setting. And I'm excited to talk to you today, Alex. So welcome.
Thank you. I'm so honored to be here. And I just want to say a huge shout out to Judy and the team and to you. I am a last minute addition, and I think that you guys finding a space for this topic, because this just broke literally a couple of days ago, shows your flexibility at a time when the whole country could use that and is suffering for the lack of it. So thank you for having me be on. I'm very honored and grateful.
Well, that's great. I'm excited excited might not be the right word, but this is a very intriguing topic. So the survey that we're referring to was actually published by the CDC. It's the mental health, substance abuse and suicidal ideation during the COVID-19 pandemic. A very weighty topic, an important topic. And I've often heard others, healthcare professionals, refer to the mental health issues that are being caused by this pandemic as being almost the second pandemic that is right on the heels of the first. So interested in your thoughts on that positioning.
Yeah, no, I've heard that term positioning as well, and I agree with that 100%. And I think anyone who's lived through it knows that, right? If you're what maybe started out in the beginning as something we felt was going to have a beginning and a middle and an end, and even though it was terrifying, we had some semblance of this is what you should do. And as time has worn on, so too has our sense of when will it end and what does it mean? And I think you see absolutely increasing levels of despair, anxiety, loneliness, isolation, depression associated with that.
Yeah, absolutely. The survey found, we'll be diving into a couple of stats, but one of the most interesting stats is that 40.9% of the respondents of this survey reported that they had at least one mental health or behavioral health condition. That doesn't surprise me, having lived through this myself over the last, 5-6 months or 5-6 years, who knows what time is like anymore. And even being in a place where I have the ability to, have a roof over my head and engage with people, I still myself have found mental conditions or concerns, a little bit of depression, anxiety. Tell us a little bit about that finding.
It's interesting. I think it's fascinating to recognize that income, in fact, is not really protective on this mental health impact of COVID and sort of the despair and anxiety it's creating across the country. I think the first thing I would say is I want to build on and really reinforce what you just said, because we have to treat ourselves first. Back in the days when we used to fly in airplanes, they would say, please put your own air mask on before putting the mask on someone else. And I think anyone who's listening, anyone who's paying attention to this topic, check yourself. Like, are you okay? And recognize that this is very, very real stress. And anyone who's listening to this right now, we're all supposed to be experts in it. And yet we're drowning and we're having a hard time. And if that's true for us, can you imagine what this is like for an hourly worker, for a gig worker, for somebody who's an essential worker who's being called into potentially harm's way on a daily basis, maybe on the front line delivering care, but maybe actually, as a cashier at Walmart, not making that same kind of money, not having that same access to resources. So for each of us, be aware of how devastating this is across the board, and then let that build up in our bellies a great hunger and drive to go be sure we're caring for those who have even less access.
Right. I often heard it said, right, we're in this together. We all are kind of facing the same pandemic, but I've heard it shift a little bit where people say we're not in the same, we may be in the same storm, but we're not all in the same boat.
Right.
Right?
Together, we're all in different boats.
Yeah, right.
I love that. I think that's a wonderful wonderful visual we all need to have. Yeah.
Right. And so what's interesting about this study is that they actually looked into some subgroups, and there were some interesting findings that they had. So let's drill into some of those. So first of all, they said, this surprised me. People between the ages of 18 and 24, 75% of them actually had some very significant mental behavioral impacts because of this.
Yeah. So, I think if you've been around someone who's 18 to 24, this is the time in your life when you've been looking forward to it. You're ready to spread your wings and go. You're about to get your first job. You're about to start having successes. You're falling in love. Maybe you're thinking about, combining households, whatever it might be. Mm-hmm. And all of those dreams are put on hold. And I'll tell you a funny story. We do a lot of work with the Rosalind Carter Institute for Caregiving. And Rosalind Carter, I think, just had her 93rd birthday yesterday, actually. And I asked her through her executive director, Rosalind, Mrs. Carter, please tell me, what have you learned being alive for so long about how we can manage through real challenges and real traumas? You've been through, war. You've been through massive shifts in our country. What can we learn from you? Help. And she said, I don't have anything to add because I've never seen anything like this. Now, remember, she's 93. Now, remember what we were like? I'm 49. When we were 18 to 24, you don't have that resiliency of having things go wrong over time and learning that you'll be okay if you just stay the course. Bad things can happen, but you will recover. That doesn't exist in our bodies when we're younger. And so I think when you look at the level of anxiety and depression and post-traumatic, real stress disorder, part of it is we don't have yet the belief that we can survive. And part of it is just plain old loneliness and isolation, because a lot of these kids, these younger folk are sometimes living alone, are literally isolated.
Right, absolutely. And, we've seen with them returning back to colleges, and we're almost casting judgments on them when we see them gathering together. And in part, I'm thinking this is a societal response. They miss each other. They crave that social interaction. So, right?
Yeah, no, I couldn't agree more. I mean, there is something so fundamental about touch and presence and being near each other and being able to read nuances and just feel the warmth of being next to someone else. There is a reason we are tribal. There's a reason that years and years ago we sat around the same campfire. Right. And we don't have that anymore. And I would also say the other thing that's interesting about these 18 to 24-year-olds is many of them, with this economic uncertainty that's being thrust upon them, they're also feeling responsible. 1 in 4 millennials were caregivers before the pandemic. We can only imagine how that's been exacerbated now. And so they're not only worried about their own situation, they're feeling responsible for others. And some of that, they're being asked to step up and take in roles that they might not otherwise have been equipped to do. So I think you see it on both sides.
Right. Well, let's shift a little bit to the group of those caregivers, right? Because I think that's also an incredible statistic. 67% of those surveyed have indicated as well that they're struggling, and these are unpaid caregivers of adults. So talk a little bit about that.
So, when people think about a caregiver, when they've thought about caregivers historically, they've often put that in the paid caregiver class. So the beautiful thing about this CDC report, and this is the part that Archangels was very, very lucky to be able to contribute to this unbelievable research team. If you want a team of folks who are off the chart smart, read Mark Seisler, Chuck Seisler, Shantha. These are incredible, incredible humans doing amazing work. Most of society has talked about caregivers often as the paid caregiver. And that is what we discussed before. It's the front line, it's the doctors, it's nurses, but it's also the postal workers, it's also the folks who are, filling the inventory at a Walmart. Sure. Those are all classified as paid caregivers. What our contribution to this study, and I think what is shocking about the findings, it's not shocking if you've been in the space forever because you know it's true. And it's not shocking once you start to realize and see yourself as a caregiver. It's these unpaid caregivers who have been invisible for so long Before COVID, we estimated that there were about anywhere, depending on what study, 45 to 53 million unpaid caregivers across the US. If you look at the data that we're finding, for example, on Archangel side, we're now seeing it's about 61% of the US will self-identify. 55% of that population says that they're new to the role. And
Wow.
so I think they're new to the role, this is not something they've been doing before. And so I think when you look at that 67% who are reporting a mental health impact, that's a lot to take on. And you're either taking it on, it's either something you've been doing historically, you have built up stress associated with it, impact on your body, literally impact on your clinical health. But it's also the stress of, let's just say you're not the person that you're caring for, you can't get to them. It's the worry about how will you get them food. It's the worry about coordinating care. People say about caregivers that they are multitaskers. You have to be a financial expert. You have to be a legal expert. You have to be a care coordinator. There's so many hire caregivers because they're multitaskers. It's an amazing amount of work that's being taken on, but it's taking a toll. And it's especially taking a toll with all of these things have intensified as they have in the past 3 to 6 months.
That's an incredible finding, and I think that that's really insightful when we think about like the impacts on our society. I myself don't identify as that, yet I find myself taking on those roles, right? And so, that's an interesting perspective.
Well, and that's what I think is so important. We talk a lot about this thing called look, love, lift. Wherever you are, look around you because there are caregivers and they don't look like what you'd expect. Take a minute to love on them and love on them for the love that they're giving and then give them a lift. The look component. So on average, most people presume like the average caregiver is a 46-year-old woman caring for her mom. And that is true, and she is. But think of that statistic I just said. Again, and this was pre-COVID. 1 in 4 caregivers are millennials. 45% of caregivers are men, right? And they're even less equipped sometimes to find access to the resources to have support. Or they might have a less tight community of friends who can step in to help when they take on this extra role. So I think what you just pointed out is so important. Please, instead of presuming that the people around you are not caregivers because they haven't raised their hands and said that they were, or they don't look like what you would expect, shift to presuming everybody is. I think an easier question to ask right now is who's not a caregiver. Therefore, go into any room, any meeting, any circumstance that you find yourself and presume that everyone around you is feeling stress and anxiety about the care of a loved one.
Yeah. Wow. That's really important to understand. Now we've been talking about, the younger generation, which again kind of challenges our biases about how people manage through stressful times, and now the unpaid caregivers. There's also a series of subgroups that we have recently been, we should have been recognizing these groups for a long time, but the pandemic has highlighted some of the endemic issues with some of these other categories that are kind of at risk. And so, we're talking about now the Black population, the Latinx population, for example, and even some of those that are socioeconomically disadvantaged, and often characterized as an essential worker for many cases in the front lines. So let's talk a little bit about those characteristics and what the study has found.
Yeah, one of the things, and I'll pull up the study also so I can be looking at this and actually quoting exact statistics for you and with you. I'll just share, I was a cashier at Walmart for 18 months. And one of the things, I fell madly in love with my coworkers. And one of the things that you saw play out in a population that was more diverse was the percentage of, individuals who were living in multi-generational households and who were swapping jobs to be able to cover different shifts. And because, a grandfather had moved in, then a younger person might be caring for the older generation while the essential worker is going out, the one who can make the most money is going out to actually work. And you see, obviously, these dynamics play out even more in some populations which have more, who have less access to resources. So specifically, I think some of the statistics was when you're looking at, and let's take a moment actually I think statistics is a beautiful quote. Statistics are human with the tears wiped away. I think sometimes we throw away this, like we throw out, 30% of people felt this, or only 30% of people felt this because it's not 60, but that's still 30%. Let's talk about the percentage of these respondents who reported having seriously considered suicide in the 30 days prior to the survey. Self-reported unpaid caregivers for adults, that was 31%.
Wow.
So close to 1 in 3 caregivers in the last 30 days before answering this question had thought about taking their own lives from the stress.
Mm-hmm.
If you're age 18 to 24, that was 26%. If you're an essential worker, it's 22. If you're Hispanic, it was 19%. If you're Black, it's 15%. Those are massive, massive, massive numbers, right? And so the implications for these populations and what we're just beginning to look at for the next set of studies that will hopefully come out on this topic. Okay, let's overlay. What if you're a Black caregiver, right? Who's an essential worker and is an unpaid caregiver? And you begin to see the compounding effect of these stresses on these populations that are experiencing these disparities and therefore having a disproportionately negative impact from COVID.
It's amazing how much this pandemic has highlighted some of the systemic challenges we have as a healthcare industry, but even as our approach to public health. What are your thoughts?
So true. I have to tell you a funny story. So there was there's a gentleman by the name of Reverend Tyrone Pitts, and I sit on the board of CTAC, and we Coalition to Transform Advanced Care. A lot of this comes down to how do we transform living our very best days until our last. Big issue for caregivers, obviously, since they're responsible for that. And the Reverend was talking about this triple pandemic, that we've got a pandemic of COVID, and we've got racism, and we've got poverty. So I called my friend Carla Denise Edwards, who's an executive now at Henry Ford Health Systems before she'd been at Providence. And I said, Carla Denise, this is amazing. It's this triple pandemic. And she said, let me stop you there. This is not a triple pandemic. COVID is a pandemic. Racism and poverty are endemic. These are issues that have been around that are foundational that we now have to start addressing. What's happening is COVID has exposed them. And when we start trying to find bright spots to all of this, right? A bright spot is we are now seeing the extent to which this is happening. And if you look at topics that are grabbing the attention of the media, grabbing the attention of politicians, it is increasingly these issues, specifically, for example, for caregivers.
Yeah, I call a friend of mine, Brian Cristrucci, who leads the de Beaumont Foundation. He actually has said this. He says, coronavirus is new, and we're still learning how to solve these problems. But economic disparities, racial disparities, those are not new, and we should be focusing on those. Yes. So what are your thoughts about how we can start to pivot? What can we do with this data? What's our calling?
So one of the archangels, we didn't figure this out until later. In the middle of the word archangels is change, right? Mm-hmm. The word change is right in there. And I love that. And we talk a lot about how do we change the conversation so that we can change culture, so that we can change lives. And I'll use caregiving as an example, but anything, because it's been stigmatized, and the only way to destigmatize something is to normalize it by changing the conversation and changing culture. But that's true with any of the other populations that we just discussed. And one of the most important ways to normalize something is we have to start talking about it. Mm-hmm. And anybody who's part of your meeting, this summit that you guys are having, they are a leader in some way. They're a leader within their organization. They're a leader within their community. They're a leader with their friends. They might be a leader within their, YMCA, whatever it might be. And one of the best ways to normalize something is for leaders to stand up and tell their own story. Because when somebody that you respect talks openly about something that's hard, like I've been suffering a lot of anxiety as a caregiver, and this is what it looks like and this is how it feels, it gives someone else permission to share their own story. It lets somebody see themselves reflected in the reality of someone that they might have thought everything was awesome for, and actually it's not. And then the biggest gift all of us can give each other right now is you're not alone, right? And then once you cross that together and you can start having these conversations, caregivers, as an example, have become experts in caregiving. They've solved a lot of these problems. So if you're a caregiver who's experienced, one of the most important things we can do is crosswalk you over to talk to a caregiver who's brand new. Nowhere are we seeing that disparity more, that opportunity more than with caregivers in COVID. Think about the 45% who've been caregivers historically versus the 55% who are new. So one of the things that we can do, start having this conversation, normalize it, share your own story with your employees, share your own stories with your populations. And then number two, help people connect to the resources that, especially if you're a caregiver, you don't know exist. You don't even self-identify as the caregiver, as you said, right? You would just say, I'm just a son, I'm just a brother, I'm just a friend, I'm just a neighbor. Actually, you're probably a caregiver. And once you allow that to come onto you, then maybe you'll be open to seeing that there are these resources that are available to help. And then we can get you access to them, because there really are a ton of resources in your state, from your employer, from your health plan that exist that can be practical and tactical in helping you get support.
I think those are good words, right? Because a lot of this it seems very bleak when you think about it. But again, it's about that shared identity. It's about that shared, we're in the society together. And, although, at times it feels like we're disparate, we're not, right? And sometimes I don't like the term socially distanced, right? I understand we're physically distanced right now, but we shouldn't be socially distanced, right?
Yeah, I agree with you 100%. Somebody just checked me on that the other day, and I said, we're social distancing, and they said, no, we're physically distancing. Language matters a lot, right? Because it helps, your language becomes what culture believes. And so I think we got to be careful. Let's use the word physically distancing. And I also think related to that, that is part of what's driving some of these feelings of loneliness and feeling of isolation and feeling despair. If we can refocus, let's try, and you guys are a bunch of marketers, rebrand, right? This around what unites us. Because there are many more things that unite us. And the most foundational thing that unites us is the need to love and be loved, to care for others and to be cared for yourself. And I can tell you across every single demographic, and I have made my entire life about working across every demographic, that is foundational. You're going to see the same angst and agita on a beautiful, young 18-year-old cashier at Walmart about caring for their loved ones, caring for their customers, caring for their coworkers, and the same confusion and, lack of clarity on exactly how to do that as you're going to see on an executive of a health plan. That's what's so funny about all this. The other way we're all the same is, even if you're super privileged, you and I are super privileged, that doesn't mean we're not lost, right? So again, that's a beautiful, as we share our vulnerability, we give other people permission to feel less alone. And that in and of itself is the first line of care.
Right. Oh, yes. And it isn't something that we're going to fix overnight too, right? We're so much as a society thinking we're a Band-Aid generation. We want to just put a Band-Aid on it and move on. This is a long-term change that we need to follow.
Well, and maybe that is another bright spot. I'm a bootstrapper, so I've never raised venture capital. And I get so frustrated when I hear up and to the right, we're going to hockey stick. Actually, what if we just take time to build something of value? Everything doesn't happen overnight. And learning how to cope with COVID isn't going to happen overnight. But that in and of itself will be a bright spot, because that is what is the foundation of resiliency. And these 18 to 24-year-olds who are having the hardest time right now, they're going to be magnificent humans as time goes on, because they're going to survive. And when they do, they will have the patina of things not always working, right? And they're going to have learned how to problem solve. They're going to have turned to each other. And may we, as folks who are older, right? I'm an elder now. It's my job to reach out to that population and say, you're not alone. How can I help? And I think in general, back to your question, what can we all be doing? Reach out to someone right now, and know that caregivers are never going to ask for help, because A, they don't think they need it. B, they don't want to bother you, right? C, they don't think it's going to come anyway. So don't ask someone, how can I help? Freaking help. Just go help. And the way we can help those 18 to 24-year-olds is just insert ourselves into their lives and be of service to them.
Alexandra, those words resonate so well with me, and it's given me hope. And inspires me to. We're on the right path. This is a time for us to make something better of what we have. Right. This pandemic has highlighted the opportunities for us to do that. So if people want to know more about the study, obviously it's been reported a lot, but what do you have any resources that you would recommend for them to go to?
Yeah. We've organized a bunch of them on our site. So if you just go to archangels.me, so archangels.me, you can find everything right there. Just literally click on resources. And one of the things that we focus on a lot is using language that is not overly academic, that is not, I feel stupid often when people talk to me about things they're expert in. I'm like, I have no idea what you just said. Mm-hmm. And sometimes they'll say, well, why don't you dumb it down? No. I would say, why don't you smarten it up? Actually, if you can really, what did Mark Twain say? It would have been shorter if I had more time. If you can boil it down to the nuts and bolts, that's what people have time for. That's what will make them feel less alone in reading it. And so we've tried to make the resources that are available on that site be very accessible, be something that anybody could read and get value from. And the other thing that we're working on a lot, we've built something that is actually included in this study, the Caregiver Intensity Index. It's not called out. We'll hopefully be doing other papers to look into it. But the Caregiver Intensity Index is something that is just a very short tool that in the taking of it, actually you see people go from thinking I'm not a caregiver to the self-realization that they are. But all of people's answers, questions like, do you feel resentment sometimes for the person you care for? Does your employer have things to help? Do you feel supported by friends or family? Do you as a family have fights over who's doing what? All of your answers are tagged, and those can be crosswalked over to resources that exist. Again, one of the things I'll give as an example, the EAP, right? Employee assistance. There are a lot of resources that already exist in employers. They're just bundled up in a way people don't know how to access. Unbundle those resources, rename them in real words that actual humans can understand, and get people access to them so they can get help.
Wow, well, that's great. Alexandra, thank you so much for taking some time out to really share some of the important findings of this study. And it's an incredible addition to this conference. So I really appreciate your time.
I'm so grateful to be a part. I'm really, really great. Thank you for including me.